This is TTT Live. I'm DK Rostar. The Ministry of Health is giving an update on the status of COVID-19 in Trinidad and Tobago. We're bringing you live coverage on TTT, Talk City 91.1 FM, and on Facebook at TTT Live Online. We go now to the Manager Corporate Communications at the Ministry of Health, Candice Alcantara.
Good morning, Trinidad and Tobago. Welcome to the Ministry of Health's virtual media conference on the national COVID-19 response. I am pleased to welcome today's panel, I'm pleased to welcome today's panel, the Honorable Terence Alcin, Minister of Health, Dr. Miriam Richards, Principal Medical Officer Institutions, and Mrs. Mei-Ling Yang Lau. She's the Honorary Secretary of the Trinidad and Tobago Association of Retired Persons. I'm Candice Alcantara, Manager Corporate Communication at the Ministry of Health, your moderator today. We go straight to some exciting opening remarks from the Honorable Terence Alcin.
Good morning, Candice. Good morning to Ms. Younglaw. Good morning to Dr. Richards. That's the doctor we have this morning. Good morning to ladies and gentlemen of the media and the wider and viewing, listening public. Today is an exciting day. And let me at once have you notice the new backdrop. If you could go to a wide shot screen, you will see we have a new backdrop today, Vaccinated. Today, it is my distinct pleasure to officially launch the Ministry of Health's COVID-19 mass vaccination communications campaign, aptly titled Vaccinate TNT. This campaign began with the introduction of the Ministry of Health's Voices for Vaccination, a series which was shown on electronic media, I think TTT, TV6, and possibly CNC3. It was designed to encourage and educate people to get the COVID-19 vaccine. The pillars of this campaign are founded on facts, not rumor, not hearsay, facts. What are the three main facts? One, the COVID-19 vaccine is safe. I could attest to that. The COVID-19 vaccine works. Millions of people around the world could attest to that. The COVID-19 vaccine, plus adherence to guidelines, is the way to control the spread of the virus. My friends, the Vaccinate TT campaign, which we are launching this morning, is a campaign of hope, where we hope that a united front of all citizens to take the vaccine will lead us from managing this pandemic to controlling the pandemic. It is a rallying cry, a cry. It's a call to action. We must vaccinate TNT to save lives and to save livelihoods. Together, every citizen, every organization, we can stop the spread of COVID-19 if we do our part. And what is that part? Vaccination. Vaccination, which we have been taking since childhood. Vaccination is an individual choice. But that choice, if exercised correctly, can help you save your life, the life of your elderly, your children, and stop you from being a statistic in an ICU unit, which Dr. Richards gives almost every day. The campaign we are launching this morning, which is supported by the Voices for Vaccination series started last week, focuses on giving each of you the information to take your life back, to take more control of your life. The vaccine plus our adherence to the health guidelines are the weapons we now have. We did not have the vaccine in these quantities before, but we now do. We, as a country, can emerge absolutely victorious from this fight if we understand our own personal responsibility at this time. But the vaccine alone will not take us out of this pandemic. You must be fully vaccinated, which means 2 doses, and wait 2 weeks after your second dose. But you must continue to practice the 3 W's. Wear your mask like this, properly over your nose, your mouth, down to your chin. Wear your mask. Wash your hands as often as you can, especially after you touch a doorknob, a door handle, a person, in the maxi taxi, in the taxi, wherever. And watch your distance by staying away 6 feet. So those of you in the lines right now for your chicken and chips, your Subway, your doubles, and I go in for my doubles later, yeah? 6 feet. It will help us. Ladies and gentlemen, we now have, and you now have, access to over 400,000 doses of vaccines. 400,000 doses. And I echo the Prime Minister's call when he said he took the vaccine that was in front of him. In front of him. It's that same vaccine which is in front of you. To date, our first dose administration stands at 252,521. That is over 250,000 people in Trinidad and Tobago have already received their first dose. I want you who have not yet received it to be a part of this drive. Let's take it up to 600,000, 700,000. And to date, 173,642 people have received their second shot. That means 173,000 persons stand a much lower chance of A, contracting the virus, B, even if they contract it, it will be mild, C, they will not go into a hospital or hardly likely, and D, the chance of this 173,642 people dying of the virus is significantly reduced. All the evidence tells us so far, globally, that most of the deaths occurring now which are avoidable is occurring in the unvaccinated. So the campaign and your access to vaccines depends on 2 things. Education, which we are doing. We are launching a new series of ads today. But 2, you must have easy access to vaccines. Accessibility. Distribution. It is now available at 109 health centers. First time, because we have these 400,000 doses. Every community from Toco to Charlottesville to Bell Garden to Belmont to down south to Mayaro to Chaguanas to Couva to Freeport to La Hoqueta. All 109 health centers are there now. Register your interest with them. Make your appointment. In addition, we now have under the RHA system 6 mass vaccination sites dealing with special groups. And I am proud to announce this morning, after paying a site visit to Wallerfield yesterday, under the auspices of the North Central Regional Health Authority, our first drive-through site will be operationalized. It is being tested now on Wednesday. So drive-through is now being added to the fixed sites. Our public-private partnership, 5 sites. The Napa site is supposed to be operationalized by 11 a.m. this morning. I was there this morning. And I want to thank the Chamber of Commerce and AmCham. They are pioneering that site. And 1 new drive-through site at the Atto Bolden Stadium under the auspices of Proman, that energy group in Point Lisas. They'll be targeting the persons and their families and employees in the industrial estate, and then eventually the community. So in addition to 109 health centers, 11 mass vaccination sites, plus Tobago, where the Magdalena is being used as a mass vac site, plus 2 drive-thrus, access is there for you. We are making it easy for you to access the vaccines. So vaccine access is not an issue at this point in time. One of the objectives of the campaign which we launched last week, Voices for Vaccination, and what we are going to launch this morning, Vaccinate TT for you and for me, is meant to safeguard the population against misinformation and disinformation. The persons on social media who are influencing you not to take the vaccine do not have your well-being and interests at heart. They are not going to pay your bills if you come down with COVID. They are not going to take care of your children if you die from COVID. They have everything to gain and you have everything to lose if you succumb to misinformation. So what are the facts? The COVID-19 vaccine is safe and effective. Fact 1. Fact 2. The COVID-19 vaccines being used in Trinidad and Tobago are WHO approved. That is your stamp of approval. That is your stamp of quality control. Fact 3. The more vaccinated a population, the more and more people that are vaccinated, the vaccine has less and less a chance to jump, spread, and mutate. Let's get vaccinated. And the fact is, the more people that are vaccinated, we can protect those who cannot be vaccinated. Like the pregnant woman, she can't be vaccinated at this time. Persons under 18, they can't be vaccinated at this time, and those with special medical conditions. So everything is in our favor to be vaccinated. Follow the facts. Follow the facts. To share facts, the Ministry of Health has partnered with the Red Cross to deliver community engagement and communications, TOP, the Trinidad and Tobago Association for Retired Persons, to target persons over 60. And I want to thank and welcome our colleague from TARP here. The Diabetes Association and the Coalition for NCDs to target that very high-risk group, regardless of age. And we will be targeting and working with more and more stakeholders to increase our educational drive. Because whilst we recognize the views that the hesitant have are your views, and you're entitled to your views, we have a duty to give you the facts so that you could make an informed and educated decision to save your lives. We are concerned about you. The folks on social media do not have your best interests at heart. The COVID-19 fight has been a long one. It's tiring. The population is tired. But let's fight together. Let's get 600,000 persons with 2 shots fully vaccinated by the end of September. That should be our goal as a country. Together we aspire, together we achieve. That's our national anthem. Now, that's our watchwords. National anthem is discipline, production, and tolerance. Let's be disciplined in our approach to this. We can do this together. As I close, it is my pleasure now to unveil the new symbol of message, a new symbol of solidarity and determination in our united fight against COVID-19. The symbol is a strong and unique element which we can all easily identify with. It is based around the V. V is for vaccine, but V is for victory and symbolizes our intended victory as a nation in fighting this pandemic. I invite every one of you to be a part of this journey, to be a part of this movement back to a state of normalcy, where we can hug our loved ones, kiss our loved ones, have a wedding, have a proper funeral service, have a birthday party. But we can only do this if we vaccinate. So do your part and let's vaccinate TNT.
Thank you very much, Minister. Let's vaccinate TNT. And we go now to Dr. Richards, who will present the clinical update this morning. And as we stay on the theme of vaccination, maybe we can encourage her to give us some insight on her motivation for being vaccinated. We go to Dr. Richards.
Good morning. Thank you very much, Candice. Good morning, Minister and Ms. Younglaw from the top. Thank you so much for joining us this morning. To the media, good morning to each and every one of you. We really appreciate your presence at these media conferences. To the viewing and listening population of Trinidad and Tobago, thank you once again for tuning in. And good morning, a special good morning to every single frontline worker, volunteer, and the persons involved in the national response to COVID-19. Firstly, I'd like to start with the clinical update and statistics as per Media Release 789, and the data provided is as of 4 p.m. on Sunday, the 18th of July, 2021. There were 103 confirmed cases of COVID-19 that represented samples taken between the 14th and 17th of July 2021. This has resulted in the total active positive cases reaching 5,780 that have been divided as follows: 5,275 persons in home isolation, 90 patients in step-down facilities, and 312 persons in hospital. At present, 250,060 tests have been done in public and private facilities, and the total number of positive cases for COVID-19 starting on March 12, 2020 to present is at 36,017 cases. Thus far, we have had 29,245 persons who have totally recovered, and sadly 992 deaths. And on behalf of the Ministry of Health team and all involved in the national COVID response, we would like to express our sincere condolences to the relatives of the deceased. The Honourable Minister would have identified the vaccination numbers which continue to increase, and at present there are 250,291 persons who have received a first dose, with 164,978 persons receiving a second dose and so considered fully vaccinated once the 2-week period has passed. I'll also like to summarize the hospital statistics as of 8 a.m. this morning, and at present the total occupancy across Trinidad and Tobago, and that involves the 1,022 beds across 16 institutions, 9 of which are hospitals for the severely and critically ill, while 7 are step-down facilities for recovering patients, is at 38%. The occupancy in Trinidad and Tobago is at 39%, meaning 4 out of 10 beds across the 14 facilities or institutions are currently filled, while in Tobago the occupancy is at 34%. When we look at the levels of care, ward occupancy is at 38%, whereas ICU occupancy is at 66% and HDU occupancy is at 23%. However, despite the fact that these occupancy levels in the ICU and HDU wards may appear low today, we have still an average of 80% for ICU patients between the 1st of June and now, and 72% for HDU patients. It means that we still have many critically and severely ill patients requiring ventilation, dialysis, and other forms of care in the parallel healthcare system. And this is an excellent reason to be vaccinated, to prevent ourselves, our family, and our relatives from being warded in a hospital, and especially the intensive care unit and the high dependency unit. There are 16 facilities, as I said earlier, in the system, and 9 of those facilities manage severely and critically ill patients. Given our critical level of 75%, this morning, 8 out of 9 of the hospitals are all under the 75% occupancy, and in the step-down facilities, a continued and consistent trend of all 7 step-down facilities being at under 75%. Lastly, when we look at the actual number of patients in hospital, there are 393 patients throughout the parallel healthcare system, while in the hospitals that manage the severely and critically ill patients, there are 306 persons, and at the step-downs, 87 persons. This consistent trend has indicated since the 1st of June that there are 3 times as many severely and critically ill patients receiving care as opposed to those recovering. So please, let's adhere to the 3 W's. Let's ensure that we are fully vaccinated, and let's pay attention to the public health regulations so that we can curb this war and to diminish our chances of having COVID-19. Candice has asked me to speak about reasons as to why I was vaccinated. And I'll start by saying that I was vaccinated to protect my mother, my brother, my sister, my neighbors, my co-workers at the Ministry of Health and the health team, the minister, of course, and Candice, and also to protect all those persons that I'm in contact with. And those are the frontline workers and the persons in the stores and my running mates in my running group and so on. Now, the question that has been asked to me by several persons up until this weekend is, how safe is the vaccine? And as the Honourable Minister indicated, the vaccine is safe and effective. And this information is guided by science and the World Health Organization recommendations, which covers information and data from 196 countries. So we are guided by a robust science in terms of the reasons for us to be vaccinated. Now, on April 8th, I received my first vaccine at the Diego Martin Health Center. And kudos to all the nursing personnel, doctors, frontline staff, support staff, and all those involved in this exercise. It has been an immensely successful one thus far. I received my second dose at the Tacarigua Racket Center mass vaccination site on June 11th. And I had minimal side effects, and I had no adverse reactions, which really underscored the need for the vaccine and its safety and effectiveness. Now, I was vaccinated principally because personally I would like to return to a sense of normalcy. Frontline healthcare workers, and especially the healthcare team led by the Chief Medical Officer, my colleague Dr. Parasram, we've been working 24/7 since February of 2020. And while we will give selflessly, and we believe that this is our national service. The Honourable Minister and our team, the CEOs of the RHAs, and all involved, we are getting tired and we need to return to some sense of normalcy. The other reason that I got vaccinated is because I love sports. And anyone who knows me personally knows that sports is one of the facets of my life that I really enjoy. And this morning at 5:05 a.m., I was out running, and I couldn't sleep much last night because I was so excited about waking up at 4 to be able to go and run. And I know and I share the sentiments of my entire running group and the persons who I swim with and the yoga studio and, everyone, my spin studio and spin class, that sports is a great part of our life. It helps us to maintain mental balance, calm and focus. And we would like to return to all sporting activities, even squash, tennis and others. I also wanted to be vaccinated to assist on a personal level in restoring the economy. Globally, the pandemic has hit all economies, and I want to see all the businesses reopened, the malls, the spas, the restaurants where we can have dine-in. This, of course, is important to the economy and as well to our recreation. Lastly, in summary, I wanted to be vaccinated for every single frontline staff who has worked selflessly and tirelessly across several ministries, agencies, the private sector, the energy sector. And we all would like to give our service, but as I said earlier, we are getting tired. It's the same staff that has been managing the national response since February 2020 and especially since March. Vaccines save lives. They are safe and effective. We are guided by robust scientific evidence. We continue to learn about vaccines. Vaccines reduce the chance of us having the virus, spreading the virus to those who cannot be vaccinated at this point in time, like children. And also, it reduces the chance of us being admitted into the ICU and HDU. As I said in a previous conference, if death has not reached our doorstep, it has certainly reached our workplace. In closing, once again, and as the Honourable Minister indicated, I'd like to ask each and every one of you, on behalf of every staff that's involved and person involved in this response, to please adhere to the 3 W's. Let's wear a mask, let's watch our distance, let's wash our hands, let's follow the public health regulations, let's become vaccinated. It's our only hope for beating the COVID-19 virus and winning this war against COVID-19. Thank you very much, Candice, for allowing me to share this personal experience.
Thank you very much, Dr. Richards. So many good reasons to be vaccinated. And as you know, this is a national effort and we've been working with certain organizations. One of those organizations is the Trinidad and Tobago Association of Retired Persons. And today I'm pleased that we have with us Mrs. Mei-Ling Yang-Lau. She is the Honorary Secretary of TAP. And let's hear from her what vaccination has meant for the membership of TAP.
Good morning. Good morning, the Honorable Minister, Dr. Richards, Ms. Alcantara. Good morning to the viewing public and listening public, and a special good morning to all TAP members. Dr. Richards, we Trinidad and Tobago say thank you. Thank you for all your service that you all have been doing, and Mr. Minister Alcin for the past year and a half. We really appreciate the efforts that you all are making. You're 24/7 going and coming. I am here today sharing with some of the initiatives that the Trinidad and Tobago Association of Retired Persons, TAP, have implemented to share information that is relevant on the COVID-19 vaccination. TAP is an avid supporter of the vaccine, especially when so many lives have been lost and so many more are at risk. Getting vaccinated provides each of us the opportunity at this crucial time to save our lives and that of our families. TARP has been engaging its members with a series of communication to assist them both with their fears and making the right choice to get vaccinated. We have been on WhatsApp, Facebook. We have had several Zoom meetings, webinars, and recently partnered with the Catholic Commission of Social Justice, a question and answer time with a doctor who answered all their concerns and their fears. And recently joined with the Ministry of Health with voices on vaccination. Moving forward, we are again partnering with the Ministry of Health with a series of virtual town meetings specifically addressing the fear of vaccine. We, TARP, are extremely pleased to have this opportunity to work with the Ministry of Health to access and pass on necessary, relevant information onto the hands of our members and their families. Our objective is to support the increased vaccine acceptance and the vaccine uptake, thus protecting our members' lives and our nation at large. TARP has supplied, and let me take this opportunity to thank Minister Alcin for allowing us the opportunity to supply TARP listing with over 21,000 members with their names and phone numbers. And I was told just before coming here, 40% of that listing heeded the call, so that is great. We are now looking forward to supplying an additional list to the ministry of our members who are 50 years to 60 years. Remember, our members are 50 and over. I am really happy to voice that TARP's president, Peter Pena, and the executive members are all fully vaccinated. I know also that there are a lot of fears out there circulating, and no better person to put those fears to rest than me. Because with the onset of COVID, I use everything possible to ensure that COVID don't get me. I've been offered all kind of herbs. I had Vicks in my nose, Vicks on my throat, Vicks everywhere. I had inhalers, mouthwash, breathing exercising, drinking vinegar water, drinking garlic tea, drinking ginger tea, just to name a few. Everything, because I just thought this thing was going to get me. Added to that, twice, not once, but twice, I wasted the healthcare people by going to get tested because I was sure, very sure, I was getting the virus. Note I said getting, eh? On the last occasion, after being told that I was COVID-free, I started questioning myself. Why all this paranoia? Why am I panicking that I am going to get the vaccine? And it's the virus, sorry. And rather than listening to everybody who came in with a story, I decided to start reading and listening to the TV, not only in Trinidad and Tobago, but the world over, and everything that was happening. And that helped my fear. I realized then that my fear was an illusion, my illusion. It was in my head. I was fearful, yes, but I was fearful of taking the virus home to my family. My husband, who has NCDs, had a series of health scares and challenges for all of 2020. He had 3 strokes, he had shingles, he had prostate surgery, you name it, he had it. He lost a lot of weight. So I was afraid that if I get this virus at all, what will happen to him? In addition to that, I am a doting grandmother. And by the grace of God, I am praying, and I pray that you too will not have to experience your grandbabies contracting the virus and have to be isolated with no one to comfort them. And you know, children get fear. They'll be in fear. They don't trust strangers. No one to comfort them. They're all on their own. The two things that they depend on in their short life is love and comfort. And then to know that I might be responsible for passing on that virus. So I made a conscious decision that we should get vaccinated. And we both did, with no side effects. Remember, my husband had a lot of NCDs. My family, and I am sure you too, is my world. And the COVID-19 gives me the opportunity of protecting my world. Please protect yours. TAP, the Trinidad and Tobago Association of Retired Persons, carries a tagline, an organization of responsible persons. TAP will continue to spread the message and the benefits of being vaccinated to members and non-members. Let us show that we are a nation, a society, an organization of responsible persons, and that we will protect ourselves, we will protect our families, we will protect our neighbors and friends. Please go to your doctor, get his blessings, and get vaccinated so that we can continue with our lives before 2020. The doctor here was with sports. We like to line, cook, and have fete. So let us enjoy our golden years. We have worked for that. So please go and get vaccinated. Thank you.
Thank you so much, Mrs. Younglau, for all your personal information and the encouragement. Thank you very much to TAP as well for working together with the Ministry of Health to encourage persons to get vaccinated. As we move into the question and answer segment of today's conference, we ask our media representatives, please indicate your name and the media house that you represent before asking two brief questions. Please ask both questions at the same time. And of course, if we have additional questions, we will come back to you. We begin this morning with questions from I-95.5.
Good morning to you, Candice. Good to see you back, and to everyone else at the head table with Phil Turner from I-95.5. Minister Alcin, permit me to ask you these two questions this morning. The first question, as it pertains to the collection of data during the contact tracing process. As you know, when you go to different establishments, they normally give you a book to put in your name, address, phone number, and so forth. What's being done to ensure that that information doesn't get into the eyes of people who it should not, who may then use that information to commit cybercrime, stalking, and so forth? And my second question, has any research been done into similarities with TB and COVID as it relates to the transmission from the disposal of corpses and the securing of burial sites to ensure that there is no spread from there? In other words, are burial spots for COVID victims marked in any way to protect other persons? Thank you.
Thank you very much for those two questions. On the issue of collection of data, all that data is securely stored at the EPI division under the control of Dr. Hines. On the issue of corpses and burials, that is something that will have to research for you. But remember, corpses are buried 6 feet underground, well secured. So the chances of COVID spreading from a corpse buried 6 feet underground, while I would not say is impossible, I have seen no evidence to date that that has been any source of spread. Thank you very much for your two thought-provoking questions.
Thank you very much. And we go to ACP News.
Hi, good morning. This is Suan Wayo from News. And to the minister, we are aware of certain types of vacation camps in person for secondary school children in small groups. Are these type of activities allowed? And also is the Ministry of Education perhaps working with the Ministry of Health to design certain types of vacation activities? And my second question is, can you also give us more information about the drive-through facility in terms of operations, location, appointments, etc.? Thank you.
Thank you. Thank you very much. Two very relevant questions. So at this point in time, we are advising against children congregating in camps setting for this August vacation, just as we did for last year. We want to minimize spread, and congregation of any type is not to be something that we should be doing at this point in time, especially for children who are unvaccinated, because children, as you know, are known to be super spreaders, especially asymptomatic super spreaders. And then they will go home, like Ms. Younglaw has said, and infect their granny. More information on the drive-thrus, thank you very much. So, 2 drive-thrus are being tested this morning. So let's go back. We tested a drive-thru a few weeks ago at the heliport under the auspices of Northwest RHA, where we vaccinated about 350 persons that day. We took that data, looked at the layout to come up with the best possible layout. We were up at Wallerfield for the whole morning yesterday. The Wallerfield site is prepped. It is ready. Beautiful pink and white tents. The reason for choosing Wallerfield and any site for a drive-through, it has to be an area where we have a certain number of acreage, because it demands a lot of acreage because it didn't have cars. So the Wallerfield site was chosen. So if there's a traffic backup, it doesn't go onto a main road, a highway, it goes onto a secondary road. The Wallerfield site is being soft tested this morning, Monday, Tuesday, and then NCRHA launches on Wednesday. The NCRHA will communicate as to who is coming there. But we have 2, I won't say conditions. We are asking the public to help us make the drive-through experience easy, because you don't want traffic. You don't want a lot of waiting. So 1, we have put up the registration forms that you are familiar with when you go to a MassVac site to fill out. We have put it up on the Ministry of Health's website. Correct, Candice?
Yes.
And we are asking persons to download it first, fill it in accurately first. So when you come to the site, you don't have to wait in a car and cause traffic. 2, we are asking persons who come in cars to come 4 persons to our car. That way, if you have 10 cars waiting, that's 40 people, as opposed to 10 cars with a driver alone. The jabbing will be done at all 4 windows. So our throughput could be heavy. So the 2 things we are asking the public to cooperate with us with: 1, download your forms. It's on the website. Fill it in. So you reach at the MassVac site with your forms already filled in. That could save you 5-10 minutes. And if you have 4 people in a car, it will save a lot of time. You don't have to look for a pen, look for your ID card number, look for your passport number. I forget my passport home, I forget my ID card home, I don't have a driver's license. It will save us a lot of time. Because the research we did in drive-through centers abroad, that was one of the areas where people were jammed up. And 2, we are asking come 4 people to our car. So that way we could get maximum throughput with a minimum amount of traffic. So that's the site at Wallerfield. It is being soft tested today and tomorrow. It's a beautiful site. We were there yesterday. The other site is at the Atto Bolden Stadium in Couva, being run and managed by Proman, which is one of the energy companies in Point Lisas. Similar process. They are targeting, in the first instance, everyone and their families who work on the industrial estate, which will be a few thousand well. Once they get through that, then they intend to target the communities around them. So we are eagerly looking to see what kind of response we get for these 2 drive-through centers. As you drive through, your first tent is to check your registration, check your temperature. Your second tent is to just double check your documents. Your third tent, covered in case rain falls, is jabbing. After you are jabbed, you are allowed to park because we need acreage. You have parking for about 100 cars, where you are asked to stay there to be monitored for 15-20 minutes, the same way you are monitored in a mass vac site. You will be told if you have any kind of reaction, side effect, you honk your horn, whatever, there will be people going up and down the parked cars. So if you experience any discomfort, there will be ambulances on spot. You have defibrillators, you have all your medication in case you have an adverse reaction. And once you spend your 15-20 minutes observation, you go to the last tent where you get your immunization card and so on. So that's the process and that's the traffic flow through a mass vac site. So they start testing today and tomorrow, and they'll be up for full action on Wednesday. Each mass vac site has the capacity to do about 1,500 jabs per day. So that's what we are aiming for, and I look forward eagerly to receiving the reports and the data to see the acceptance and whether we need to do it in more areas once we could find suitable accommodation. Thank you very much.
Thank you very much, Minister. And I think now we're going to 103.1 FM.
Hi, good morning. Rai Rikomas from 103.1 FM. I have 2 questions, but I just wanted to, first of all, get a bit of clarification regarding the Wallerfield site from the minister. Is it the racetrack we're talking about, or where exactly in Wallerfield? My 2 questions are as follows. The Prime Minister said on the weekend about an incident of someone not wanting to follow the rules on entry into Trinidad through the new open borders. Has there been any further incident coming out of the arrivals and any persons unvaccinated who had to go into quarantine so far? And my second question has to do with the online portal for entering Trinidad. Have there been any further issues to correct so far since the site has gone live? For example, I know it was spoken about before, adding seaports to the online site. Those are my questions. Thank you very much.
Thank you very much for your 3 questions. So I will take them one at a time. So the answer is yes, it is on the racetrack. And may I say, yesterday was the first time in about 40 years I used to go there in the days of Selborne Clark and Brian Ibrahim to watch car racing. Those names may not mean anything to the youngsters of today. Selborne Clark, Brian Ibrahim used to race Frankie Bourdram in those days. So yes, it's on the racetrack. 2, any more incidents? We only know of that one so far that the Honorable Prime Minister spoke about on Tuesday. And on the online portal, I would prefer if the minister responsible for that issue speaks to it, that is Minister Stuart Young, and or the Minister of National Security. I wouldn't be able to share any more information. That is not our Ministry of Health initiative. Thank you very much.
Thank you, Minister. Now we go to TV6, please.
Good morning, everyone. Urvashi from TV6. Minister, as surges of the coronavirus rage across the world, well, there comes fears of this new Delta variant entering populations. Of course, our borders were reopened on Saturday, and we noted that unvaccinated persons, they do in fact go into quarantine, but vaccinated persons are allowed to go out into the general public. Given that the Delta variant can infect vaccinated persons and can be spread by vaccinated persons, can you tell us if there is sufficient and what surveillance methods are in place to capture this new variant of concern if it does enter borders through that avenue? Also, Minister, we're seeing, my second question is that we're seeing, whereas Trinidad and Tobago has always awaited the WHO as it relates to vaccinations and also treatment mechanisms for COVID, we see that there are other countries that use their ministries of health and regulatory bodies to make independent decisions. For example, St. Vincent, they would have okayed the Sputnik vaccine ahead of WHO's approval and so on. And we're also seeing countries across the world, they're using this drug, ivermectin, which is being studied now. What is stopping or what is lacking from our local perspective, either the Ministry of Health or regulatory bodies, that we can't or we aren't making those types of decisions? Thank you.
Urvashi, I will take the second question about decisions and ivermectin, and Dr. Richards will take the first question. There is absolutely nothing lacking at the Ministry of Health. Let's leave it at that. We have taken a decision to go with evidence and science. If we had gone on the bandwagon from day one, we would have been using hydroxychloroquine. Persons would have died. And then the question will be, why did the Minister of Health and the Ministry of Health not follow WHO? The same thing applies to ivermectin. At this point in time, there is absolutely no data, and Dr. Richards could correct me if I'm wrong, no data or no evidence that ivermectin works. So there's nothing lacking at the Ministry of Health. What the Ministry of Health is doing is going on science to protect the population. And we have said this before. Could you imagine what would have happened in this country if we had decided to use a non-WHO approved vaccines and people died? The question that would have been asked is, why did we make that decision and not follow WHO? So it's a case of damned if you do, damned if you don't. But in managing something like this, we are always guided by robust science, robust evidence. And the Ministry of Health, with all its partners, including CARPHA, University of the West Indies, and WHO, will only make decisions which can stand scrutiny and impact the lives of the population in a very positive way. And is a decision that I think we at the ministry could stand by, because if the opposite had happened, suppose we had used one of the vaccines that were non-WHO approved and people died, could you imagine the lawsuits that would have followed? And the actual ravaging of any subsequent vaccination program. People would have lost total faith in any vaccine. In any vaccine. So, as we keep saying, countries are sovereign. They are entitled to make decisions as they see fit, as we are also sovereign. Thank you very much, Urvashi. Thank you for your very thought-provoking question. And I turn you over to Dr. Richards to deal with the issue of border.
Thank you, Urvashi, and thank you, Minister. So, Urvashi, you are correct. There has been an increasing incidence of the Delta variant worldwide and even within the CARICOM region. At this point in time, there are no confirmed cases or confirmed laboratory cases of the Delta variant. And yes, we do agree that there is a risk of introduction of the Delta variant with the reopening of the borders. However, the Ministry of Health and the government of Trinidad and Tobago has implemented several measures to reduce the risk of transmission and entry of the Delta variant, starting with the PCR protocol testing 72 hours before, an eyeballing and port health clinical assessments on site, the protocol, the Ministry of Health protocol, effective July 17, 2021, which separates the unvaccinated persons who are under state-supervised quarantine. And I have to reassure you that these persons are monitored on a daily basis by the respective county medical officers of health. We have had a couple of unvaccinated persons entering the country between Saturday and present, and they are being monitored. And their clinical symptoms and testing will be done on day 7 of the 14-day period. We also have measures to reduce risks amongst children who are not vaccinated, and they would be tested once again at or around day 5. Now, I want to just reiterate the social responsibility that members of the population need to take. The government has put in several or implemented several risk mitigation measures. We ask members of the population to further assist us by paying attention to the public health regulations, wearing your mask properly, and following the other 2 W's, watching our distance and washing our hands. With this in mind, and the persons being fully vaccinated, there's a significant reduction in risk of the variant entering our population. So please, let's be responsible, and thank you very much for your question.
Thank you very much. We go now to Guardian Media Limited.
Hi, good morning, everyone. Renuka Singh from the Trinidad Guardian. My both questions are probably best answered by Dr. Richards. We have understand that in Tobago there are 5 ICU beds, 4 of which are currently occupied, and there's been a confirmed 18 cases overnight. What happens, or what provisions are in place for Tobago should more than one additional person degenerate to the point of requiring ICU facilities? And secondly, with the Sinopharm vaccine not being recognized by some countries, we've had travelers saying that they're considering a 3rd shot from another brand, or perhaps landing in another country and accepting another branded vaccine. Is there any medical advice you can give to those persons? Thank you.
Thank you very much. Regarding the situation at the Scarborough General Hospital and in Tobago, the Ministry of Health is committed to working with the Tobago Regional Health Authority, their clinical and administrative team, in identifying areas for improvement and really managing the increased number of cases in Tobago. So I would really direct you to the TRHA for further information on the situation there. Now, the Ministry of Health, as the Honourable Minister emphasized, is the decisions are based on technical advice and international recommendations from the World Health Organization. Regarding the vaccine administration and rollout, we have always believed that safety should trump expediency in the selection of the vaccines and the dosing regime. We are open to amending our policies once the recommendations come from the World Health Organization. But as of this time, the World Health Organization has given or outlined a dosing schedule for different vaccines based on the brand and the active unit in the vaccines. And at present, the information would be for the vaccines relevant in Trinidad and Tobago, a 2-dose regime for the AstraZeneca and a 2-dose regime for the Sinopharm vaccines. So we are guided by this information, but of course, given research and ongoing research, we will update our protocols and policies as we see fit. Thank you very much.
Thank you very much, Dr. Richards. And so time is tight with us today, and we end with questions from Radio Tambourine at this point.
Right. Hello, good morning. Clayton Clark, Radio Tambourine. My first question to Minister Alcin: what is the latest with Canada not allowing flights originating from Trinidad and Tobago to enter that country? Flights from TNT are going through Guyana before heading to the US and Canada. Does that have anything to do with the choice of vaccines being offered here? And my second question: employees of one particular fast food establishment here in Tobago have indicated that they are not willing to be vaccinated before going out to work. They are arguing or contending that even after being quote unquote fully vaccinated, they are saying that they can still contract and spread the virus. What can you say to those individuals and others who hold similar positions?
Clark. So the issue of Canada and access to Canada and going through Guyana, I suggest those questions be posed to the relevant agencies, which would be like Ministry of National Security and so on. The Ministry of Health can't answer those questions and ought not to get into that realm. We are responsible for the health response within our borders of Trinidad and Tobago and devising policies to help people enter. But which country decides which vaccines they will accept? As I said before, that's a sovereign decision. 2, on the issue of employees in Tobago, you may recall we have always said, and I said it in my opening, the vaccine severely decreases your chances of contracting the virus, severely decreases the chances of you getting severe disease, and severely decreases the chances of death. The vaccine, as we have always said, is not 100%, but we can guarantee you, if you are not vaccinated, you stand a high chance of contracting the disease, of getting into ICU, and possibly dying. So it's personal responsibility. And people have to make wise choices to make sure they don't end up as being a statistic on the bad side of things. Be a statistic on the good side. That is, be one of the 600,000 persons that are fully vaccinated by the end of September. As Ms. Younglaw said, do it for yourself. Do it for your husband or wife. Do it for your grandchildren. Do it for your neighbors. But most importantly, do it for yourself. Thank you very much, Clayton. Excellent question. Thank you.
Thank you very much. We have come to the end of today's media conference. Thanks to Minister Dr. Richards, Mrs. Younglaw, and all those who had a part to play in today's conference. Remember, the WHO-approved COVID-19 vaccines are safe and effective. Please take the COVID-19 vaccine when it becomes available to you. Remember the 3 W's: wash your hands, wear your mask, watch your distance, and of course, vaccinate T&T.
There have been many conversations and concerns expressed about the COVID-19 vaccines and vaccination. So I'm going to share a few facts with you. Fact: vaccines protect against viruses that can cause disease and death. You may not remember, but during your first year of life, you were vaccinated against viral infections such as polio and measles. These vaccines protected you and are probably now protecting your children from death and complications associated with polio and measles infection. Fact: SARS-CoV-2 virus is here to stay.